Good morning, America. I'm talking to you from CABOS, San Lucas again today. Actually sitting in the same spot as I was for the last couple of videos. I know I seem sometimes to hammer our medical profession a little hard, but sometimes I really have a pain in my heart when I look at my profession. When I graduated from medical school in 1968, do you know that we ranked #1 in the world in healthcare? And #1 in the world in education. And as our education has slid downhill to the very last in the world among industrialized countries, do we have teachers that care about this education? Something has to change. Our healthcare has gone to last place in the industrialized world also. All the doctors I talk to, nobody's happy about what's happening in healthcare, but nobody seems to have an answer. And I need all of you doctors to put thoughts into this. I ask people to please come up with answers. What are some things we can do to change healthcare? I will let you know that years ago when I practiced medicine, we didn't have HIPAA laws. To me, HIPAA stands for an 8,000-pound hippopotamus that's in every room in the hospital. Once we've signed about that many pounds of pages of forms saying we're going to keep your records private, we go ahead and lose 10, 20 million of them at a time in the electronic medical system. Used to be maybe we'd misplace one on a cart one day in a hospital. Do you know that today in the United States, 30% of all laboratory tests are repeated? Do you know why that is? We repeat those 30% of tests because of all of our great laws protecting everything. 30% of our tests are lost, so we pay for the repeat of those tests. I need all of you doctors to start complaining about these things. I know you're so busy seeing patients and you're pushed so hard by your bean counters that you're hired by. It will not be many years before we do not have private practice in the United States. And then all of our care will come from a corporation. And whereas it might be good and ideal if Walmart took over healthcare in the United States, I'm sure everything would run more smoothly, cost much less, and we'd probably get better results. But that probably is not going to happen. Please do your best about deciding what we can do to improve healthcare in America. Please take the time once in a while to drop me a line. Just Rickr, R-I-C-K-R, at maverickdoctor.com. Take the time to write thoughts down. And I'll guarantee you, if we don't get these thoughts written down and I continue on this way, I'm going to, and I'm going to keep on trying to do this until I drop over dead. This is going to be a one-man show again unless all you doctors can get your thoughts together and work together so we can change this. God bless all of you. Have a wonderful day.